Hello dear students, welcome back to my YouTube channel Physiology Learning. So in this video, we are going to continue our special senses vision, and this is the last video of our vision series wherein we are going to discuss about the visual reflexes. Without further ado, let's get into the topic. The visual light reflexes are basically divided into, we can talk about the pupillary light reflex, and there is one more reflex which is called as accommodation reflex. So let's get started with pupillary light reflex. As the term indicates, this regulation of size of the pupil depending upon the light source is called as a pupillary light reflex. If you throw a light into the pupil, what will happen? It is going to constrict. This you must have done it in your practical classes also, or you will be doing it in future. This regulation of the pupillary size based on the ambient light level is called as a pupillary light reflex. And there is one reflex which is called direct light reflex. For example, if I am throwing a light into my right eye, and if the right eye pupil is constricting, that is called direct light reflex. But if I throw the light into the right eye, the opposite eye also will have a pupillary constriction in a normal person, which is called indirect light reflex. We are throwing it in the right eye, but it is constricting the pupil of the left eye also. That is called indirect light reflex, which is also called as consensual light reflex. Consensual light reflex. So let's see what is the pathway for this light reflex. So you are just throwing a torch light, and first it will be received in the retina. Then the following pathway is mostly similar. It will go through the optic nerve, then optic tract, then lateral geniculate nucleus. From the lateral geniculate nucleus, this is the optic pathway we have already discussed, the retina of the eye. Then we have the optic nerve, then followed by the optic tract. The crossing over is called as the optic chiasma region. Then it is going to the lateral geniculate body. After going to the lateral geniculate body, it goes to one more area which is called as the pretectal nucleus. As you can see in this diagram itself, it is going to the pretectal nucleus. So this is one important area. From the pretectal nucleus, one important thing to note down here is, if you closely observe this diagram, the green fibers from here, they are going to the same side also, as well as it is going to the opposite side also. Where they are going? They are going to the Edinger-Westphal nucleus. They are going to go for both sides Edinger-Westphal nucleus. That's why we are getting the response in both the eyes. So from the pretectal nucleus, it is going for the Edinger-Westphal nucleus of the both sides. Then after that, it will be carried forward by the cranial nerve 3, that is the efferent. As you can track it, it is going to the ciliary ganglia. Then finally, the smaller nerves will come, that is called as the short ciliary nerves, which will cause the constriction of the pupil. And since it is innervating both sides Edinger-Westphal nucleus, both sides constriction of the pupil will happen. This is the pupillary light reflex, direct and indirect. What is the importance of this light reflex? So first is, when you are going to a very bright environment, the pupils will constrict so that it controls the amount of light entry. And the pupillary size can vary the light levels up to 16 times. Suppose when you start from the most constricted level, it is like a camera. The pupillary is like a shutter. Suppose if I open the shutter too wide, up to 16 times more light we can get it. That's what this means. And next is, it will help to increase the depth of focus. Just like a shutter in the camera, whenever there is a smaller diameter of the pupil, the better depth perception will be achieved. So just like a camera, in a camera also, if you try to lower the size of the shutter, what is going to happen? There is going to be a better depth perception. Just like a camera, it is going to function. So these are the important things about light reflex. Next, going to the next reflex, that is called as the accommodation reflex. This also you will be doing it in your experiments, wherein we will ask the subject to look at a distance. Then immediately what we will do is, we will try to bring an object in front of them and ask them to focus on the tip of the object. For example, like I will be focusing at a camera, and immediately I'll ask the subject to change his focus on the tip of this pencil. So when I'm doing it, if you have watched closely, both of my eyeballs, they were coming closer to each other, that is, they are converging. So there are three components which happens. One is the convergence, which you could have also seen in the video, convergence of eyeball, convergence of the eyes, and there is constriction of the pupil. Here also constriction of pupil is happening. And the third important component, which we are not going to see, that is happening inside, that is increase in curvature of lens. Due to the ciliary ligaments which are holding the lens, they are going to change. There is an increase in curvature of the lens. Suppose, for example, the lens is flat like this. Now what will happen? The lens curvature will increase like this. So this is called as the increase in curvature. And some of the books write the accommodation reflex means it is the increase in curvature of the lens. Here all of them will happen. So you can remember it like 3 C's. Convergence of the eyeball, then the constriction of the pupil, increase in curvature of the lens. So all these things will happen. So now let's see the pathway. So from the retina, the same thing starts. It goes to the optic nerve, then the optic chiasma, then the optic tract, till the lateral geniculate nucleus. It is the same pathway. Then after that, via the optic radiation, it is going to go to the visual cortex. Whereas in the previous pathway, it was a little different. So it is going to go to the visual cortex. And from the visual cortex, I need efferents for all these 3 actions. So first one, it is going to go for the Edinger-Westphal nucleus. What is the function of Edinger-Westphal nucleus? Just now we saw it is going to cause constriction of the pupil. So it is going to cause constriction of the pupil, as well as it is going to cause the ciliary muscle contraction, which will help in increase in the curvature of the pupil. So both these actions are done from the Edinger-Westphal nucleus only. So pupillary constriction 1 is done. There is an increase in curvature of the lens is done. But again, third component was happening where their eyeballs were converging. That is done from a different area that is called frontal eye field. From the frontal eye field, again the third cranial nerve is going to come. The output is going to come to the same nerve. The third cranial nerve will give the output and it will activate the muscle that is called as medial rectus. So as the name indicates, medial rectus, it is going to focus and bring it medial. So it will cause convergence of the eyeball. So these are the 3 events that is going to happen, and these are the efferent pathway for this particular accommodation reflex. Next, there is a syndrome which is called Argyll-Robertson pupil, ARP. So from here itself there is a clue, ARP. So you can write it like accommodation in this patient's accommodation reflex is present, ARP. From there itself you can write reflex present. And if you read it reverse, it is like PRA. So I can write it as pupillary light reflex absent. So why in this particular Argyll-Robertson pupil, accommodation reflex is present, but the pupillary reflex is absent? So you are going to look into it and put it in the comment section. I'll be happy to share whether it is a correct answer or not. So I hope it's clear. I hope you have enjoyed the vision series. Next, we are going to start the series of hearing and smell and taste also. So stay tuned for more such videos. Thank you for watching the video and subscribe to the channel and do forward to your friends whom it might help. Thank you so much.